on the Doctor's In. It's time to catch up with Dr. Nick Kanagita again this week. Thanks for your time, Dr. Nick.
Pleasure to be here.
Now, this week we're going to have a chat about soft palate injuries and well, how often do we see it in harness racing?
Yes, it seems particularly common in harness racing for whatever reason, and standardbreds seem to have this problem far more than we see in thoroughbreds. I mean, it's a big problem in thoroughbreds, but we do see it a lot in standardbreds. And I think part of that is their head positioning and the gear that's on there. We can induce soft palate dislocation in a horse just by manipulating the position of its neck quite easily. And if you pull the neck in, interesting, that's when they dislocate the palate. If you let it out, they tend to stop. So, you know, that may be part of it with harness racing, but we do see it a lot. And I guess people sort of say, well, what exactly is soft palate problem? And anybody that's been to the races or been behind a horse, you know, driving it, and the horse develops a soft palate problem, you know about it. Now, they make a terrible gurgling noise. You know, it's a very loud gurgling noise. It's akin to snoring, right, effectively in people. And the soft palate in the horse is very long, and so as that dislocates from where it's meant to be, it just vibrates and flutters in the airflow coming in and out, and they do make a really loud gurgling noise, which as soon as they swallow and reposition the soft palate, it can disappear just as quickly. But during a race, they often have trouble with it. And so these horses, you know, they can be racing along quite well, and then suddenly they dislocate the soft palate, which means it's no longer held down by the epiglottis, which is a bit of cartilage at the front of the larynx, gets away from that, and then it just flutters in the breeze and makes this horrible noise. And that can happen mid-race and makes horrible noise, and because of all the turbulence that creates, they just don't get enough oxygen. And these horses, they can just fall back through the field very, very quickly. And then often, you know, as they stop and they settle, they get the epiglottis back over the soft palate, suddenly it doesn't vibrate, and the noise can just disappear just like that. So if you've got a horse that's making a very severe gurgling noise that starts suddenly and stops suddenly, there's a very high chance it's a soft palate dislocating.
What do you do?
Well, the first thing is to diagnose it correctly. And so what we'd like to do is endoscope the horse. Usually we do that at rest first, so we put the tube down the nose and just have a look at the upper airway and see what's happening with the fibre optic endoscope. Unfortunately, in most horses with soft palate dislocation, it looks pretty normal at rest, because there's no pressure, there's no stress, and so it just sits there. So again, that's an indication that the problem may be a soft palate. Sometimes we'll see other predisposing factors, some other problems in the throat, and we say, look, okay, well, this is the cause, and the soft palate problem may just be secondary to that. Let's fix the primary cause and then see how we go. If we're not convinced at that stage and we're not sure, we can do what we call dynamic endoscopy, whereby we actually put the endoscope in and work the horse fast. And you have to work them until they actually make the noise. If they don't make the noise, it's no good. So the endoscope's on, it's recorded either in a box attached to the horse, or some systems it's remote, it's wireless, and so you can record it and just see what's going at high speed. So when they make the noise, you can see exactly where the turbulence is, where the fluttering is, where the problem is. That's the most accurate way of diagnosing it. But again, it's not cheap. I think you're looking at about, you know, $700 to $1,100 just to get that diagnosis done. And if the horse doesn't make the noise, it's not going to help you. So let's assume, okay, we have diagnosed the soft palate problem. Depending on the age of the horse influences what we want to do. In a lot of young horses that have got very inflamed throats, we just try to give them time. And a lot of horses will grow out of it as they mature. If it's an older horse, or the owner's, you know, the trainer really wants to push on with a campaign, then we can try different techniques to manage it. Most common, of course, is a tongue tie, and everybody's heard of tongue ties, and they can be very effective. And what they do is they actually pull the whole larynx and the epiglottis forward and jam over the top of the soft palate. So it's just physically harder for that soft palate to become free. So tongue ties, you know, again, applied correctly, can be very good. And I just stress to everybody, you all know that, take the tongue tie off afterwards. Unfortunately, we do see a few horses, particularly after a big win, where people forget about the horse, they forget about the tongue tie, and the next morning the tongue's either off or pretty damaged.
Can that happen?
Oh yeah, I've seen quite a few horses where they come in with a horse here and the tongue here, and yeah, once it's off, it's off. But we've had some it's half cut off, and we can, as long as there's a bit of blood supply left, it'll heal well. I mean, most of them we can get back on, but once it's completely off, that's it. So take the tongue tie off. Just a little tip for you. So tongue ties are good. The other thing is crossover nose bands to keep the mouth shut, because if they're breathing a lot of air in the mouth, it tends to push the soft palate up and dislocates it more. Not that they normally breathe through the mouth, but during racing, if their mouth's open, they get air through there, and that can do it. So keep the mouth closed if you can. So that's the other thing to do. Then we've got other things like the corneal collar, which most people have heard about. That's very expensive, and it was actually designed for standardbreds. So it does work a lot better in standardbreds than it does in thoroughbreds, because they've got different larynxes. People don't realise that, but they're quite different, the larynx of a thoroughbred compared to a standardbred. So the corneal collar actually does work a bit better, and that's a collar that you put around the neck of the horse, and again it jams and pushes the larynx forward, and you tighten it, and it can work quite well in some horses, but if it slips or moves in the slightest, it's a disaster, and the horse can be a lot worse. So I'm not a big fan of the corneal collar, but if people want to try it, that's something you can try. So we try those sort of things, medication to get the inflammation down in the throat. Try those things first, which are either time, tongue tie, nose band, maybe the corneal collar, these sort of things to try to minimise that.
Can you operate?
You can, and if none of those things work, then we go to surgery. And there's quite a few different surgical techniques that can be used, ranging from the quite bizarre to the semi-sensible. Actually, again, going back to Turkey, one of their favourite techniques there is to cauterise the soft palate, and they're very good at it. And they put a big spatula, just like short anaesthetic, down the mouth of the horse, and they just basically cook the underside of the soft palate. The smoke goes everywhere, and they cauterise the soft palate, and in the theory of tightening it up. I'm just not sure how well it works, but they're very good at it. Oof. They do a lot of them. So you can do surgeries on the soft palate directly, but if you overdo it or cause any damage to the soft palate or put any holes in it, it's the end of the horse. And I'm not really sure that they work very well, so I tend to stay away from that. The other surgeries that we do are aimed at either pulling the larynx forward artificially or stopping it from being pulled back. And so what we do is we either cut all the ligaments and the muscles at the base of the larynx, and so that it can't get pulled back and it stays forward, it goes further forward. And that can sometimes help. That's what we call a myectomy and a tenectomy, if you want to look that one up. So that's one. But the more common procedure now is what we call a tie forward procedure. That's different to the tie back procedure. Mm-hmm. So if you're doing it at home, make sure you get the right one. Now, tie forward procedures, we basically put in two big sutures in part of the larynx and pull it tight together. And it's amazing. When we're operating these horses, we have them on their back and their neck's out, and we do the surgery through the base of the neck, and we tighten that suture up. And when we do it, we flex the neck up and tighten the suture right up, both sides, big suture in. When we let the neck go, these sutures will actually hold the neck up, the whole head up. Wow. And you know how heavy a horse's head is? They're quite heavy. And it's amazing that these two sutures in these bits of cartilage, instead of the neck being stretched flat out, by the time we've finished, it'll sort of only be half down, and it takes all the weight of it. And so it can, again, that can work very well in selected cases, but it doesn't work all the time. But if you want to try anything, that's what we do at the moment.
Favourite question, how long off?
With the tie forward surgery, we put them back into work about 2 weeks after surgery, because it's a mechanical thing. There's nothing needs to heal.
Yep.
If we've done the tenectomy and trimmed the back of the soft palate a little bit, we used to give them a little bit longer off, but not too much. But we get them back into work pretty soon.
And a success rate?
Again, anywhere between 60 and 85%, somewhere around there. It just does vary a lot from horse to horse, because there's so many different causes that it's, every horse is a bit different. And again, I don't think we know nearly enough about soft palate problems in any species. There's a lot of research being done, a lot of theories as to why it happens, and at the end of the day, we don't really know why it happens in some horses, and so it makes it very hard to fix it and prevent it. But my theory is it's a problem with the nervous system or some of the nerves in that area. But trying to control it and manage it's hard. But if the surgery works, yeah, they can go back into work pretty much straight away.
And final question, is it an individual basis per horse, or does some vets like doing one way and they do all the same same treatments? Or?
Yeah, there's a lot of difference in opinions, in the veterinary world as to what the best way to manage it is, and I guess it depends a little bit on where you've trained and what your experiences are, and whether you've been more involved with thoroughbreds or with standardbreds too, because I think there's a bit of a difference in that as well. So, again, if anybody says they've got a cure for soft palate dislocation in horses, or getting the tongue over the bit and dislocated the soft palate, then chances are they're wrong. All you can do is just try to manage it as best you can, and hopefully you can get the best results. But we'll have this same conversation with trainers about the expectations of the treatment, and if we're going to surgery, look, we say, look, there's no guarantee, but we just try these different techniques, and it may be in a year or 2 or 5 years' time there's another technique that we all have to try, and that's the nature of it. The ones we've got aren't a cure. It's the best we've got at the moment, and so that's what we need to try, and if it works, good. If it doesn't, well, there's not much more we can do, unfortunately.
All right, Dr. Nick, thanks for your time this week.
No worries.
There he is, Dr. Nick Kanagita, speaking with me on the Doctor's End this week.